Hey guys, this is Dr. Hub. Today we'll look at the movements and the muscles which are tested in terms of the lower limb. So first is the hip flexion. So under the hip flexion, the muscles which is involved is the iliopsoas. So this muscle, there's the involvement of the spinal nerve that is L1 and 2. So what is the nerve which is involved here? In terms of hip flexion, the iliopsoas muscle, the nerve involved is the femoral nerve. Next we move on to the hip adduction. So we move on to the hip adduction. So in terms of the hip adduction, there is the muscles involved is, as its name suggests, it's adduction, it is adductors. So the spinal nerve involved here is, it goes in sequence. The hip flexion was L1, L2. So in hip adduction, it is L2, L3. And what is the nerve which is involved in the adduction? Adduction means towards the body. So the involvement is the obturator nerve. Then when you look at the hip extension, so we look at next is the hip extension. So in terms of hip extension, there is the muscle involved is the gluteus maximus. So gluteus maximus is the muscle involved with the hip extension. So what is the spinal nerve which is involved here? The spinal nerve which is involved here is the L5 as well as the S1. So L5 and the S1 are the spinal nerves which are involved here. And what is the nerve which is involved in terms of the hip extension? So in hip extension, there is a inferior gluteal nerve. Inferior gluteal nerve which is involved. Then we move on to the knee flexion. So in terms of the knee flexion, what is involved? So under the knee flexion, there is the involvement of the hamstring muscles. So knee flexion, it involves the hamstring muscles. And the spinal nerve here is the S1. The spinal nerve here is the S1. And what is the nerve which is involved here? It is nothing but the sciatic nerve. Sciatic nerve is associated with the knee flexion. Whereas in hip extension, it was the gluteus maximus, that is the L5, and the S1, that is the inferior gluteal nerve. Now we move on to the knee extension. So flexion we saw was the sciatic nerve, and in terms of the knee extension, what is it? So in terms of the knee extension, it was the quadriceps femoris. So we are writing it as QF, standing for the quadriceps femoris. So what are the spinal nerve branches of the quadriceps femoris? It is going to be L3 as well as the L4. So easy way to remember, it is extension. So E looks like 3, so it is L3 and L4. Now we look at what is the nerve involved in terms of the extension of the knee. So in flexion, we saw it as a sciatic. In terms of extending, it is going to be the femoral nerve. Then we move on to the ankle. So ankle, whether it dorsiflex or the eversion. So now we are going to look at the ankle and its dorsiflexion. So we're writing it as DF, that is stands for the dorsiflexion. So what is the muscle involved? It is the tibialis anterior. So dorsiflexion, it is involving the tibialis anterior. The tibialis anterior is the muscle which is involved in the ankle dorsiflexion. So what is the spinal nerve which is involved? The spinal nerve involved is nothing but it is the L4 is the spinal nerve which is involved. So now we are talking about ankle dorsiflexion. So what is the nerve here? The nerve here is the DF. So in terms of the dorsiflexion, it is the DF, that is the deep fibula. It is a deep fibula. Then we'll move on to the ankle inversion. So in terms of the ankle inversion, in terms of the ankle before the inversion, let's look at the ankle eversion. So in terms of the ankle eversion, the muscles which are involved is the fibularis longus. So it is nothing but the fibularis longus as well as the fibularis brevis. So it is the fibularis longus and the fibularis brevis. So what is the spinal nerve involved here? So So fibularis longus and fibularis brevis involved in the ankle eversion, it is the L5 and the S1. So there was another nerve root with the L5 S1, it is the hip extension, that is the gluteus maximus with the inferior gluteal nerve. So here in ankle eversion with the fibularis longus and fibularis brevis, the L5 S1, it is the superficial fibular nerve. The superficial fibular nerve. Next we move on to the ankle inversion. So we saw the ankle eversion, now we look at the ankle inversion. So in terms of the ankle inversion, the involvement is of the tibialis posterior. So inversion was tibialis posterior and eversion was nothing but the fibularis longus and the fibularis brevis. So ankle inversion, involvement of the tibialis posterior. So tibialis posterior. So what is the nerve root here? So eversion, it was L5 S1. So now we go further, that is we go before, that is the L4 L5. And what is the nerve involved in the ankle inversion? The inversion, it always involves the tibial nerve, and the ankle eversion, it always involves the superficial fibular nerve. Superficial fibular nerve is involved with the eversion. Inversion is always the tibial nerve. So it is the tibial nerve. Now we move on to the ankle plantar flexion. The plantar flexion. So in terms of the ankle plantar flexion, what is the muscle which is involved? Muscle involved is nothing but the gastrocnemius and also the presence of the soleus. They are the muscles involved. So what is the spinal nerve? The important root of this, it is going to be the S1 and 2. And in terms of the ankle plantar flexion, the nerve involved is the tibial. So we saw the tibial is involved in the plantar flexion as well as the ankle inversion. So the roots are different. In terms of inversion, it was L4 L5. In terms of the plantar flexion, it is going to be S1 S2. Then we look at the greater toe. We look at the greater toe extension. So in terms of the greater toe extension, it is the EHL. EHL stands for the extensor hallucis longus. Extensor hallucis longus. So the greater extension is by the EHL, that is the extensor hallucis longus. So what is the nerve root of the extensor hallucis longus? The nerve root is now going to be the L5. And what is the nerve? The nerve involved is nothing but the deep fibular nerve. Deep fibular nerve. To learn and grow daily like this, please do subscribe.